You on AI listening in on your chat with your doctor, because soon it will be you, your GP, and an AI bot listening and recording and transcribing and summarising everything that you say in the surgery.
Britain will be one of the great AI superpowers.
AI.
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 We will make sure that this technology is safe.
Okay, so this is huge and worrying and exciting and all of the things, okay? So the first thing I would say here is there is no surprise to me that the government is pushing AI into clinic rooms because they're forcing GPs to train AI essentially with the aim of replacing GPs with AI. Of that I have no doubt, and I think that's been on the cards for a long time. But I think this is a double-edged sword because not only is it exploiting GPs and their years and years of experience and knowledge, but it's also exploiting patients by trying to train up the models based on your medical information and potentially exploiting your medical information. That's the first point. If I haven't met you before, I'm Dr. Christina Davies. I work within digital health and health app space for women. And the one thing I've really learned from working within health apps is how little medical credibility there is within the app space. Only 43% of apps have actually any genuine medical information or guidance in them. The rest is things that have been AI generated. So we'll go into that a bit more later. So AI is already trained in a similar setup to what most of society is, which means sexism, racism is already embedded in AI because AI has essentially been trained by men. I think as we move forward within an AI space, not only are we funding the people who own the AI platforms, and let's be honest, that is not the patients, that is not the doctors, but we're also coming under the same rules that society already has. And I think vulnerable groups like women and other vulnerable groups within society will continue to suffer the effects of poor healthcare as part and parcel of that setup. I love this idea of we will make sure that there's low risk, etc., when actually the current NHS basic computer systems don't even really work. Like the hospital computers and the GP computers rarely communicate with each other. So when you go to your GP and say what's come back from the hospital, they're probably waiting on one specific letter that may have gone electronically, but they also might be waiting for it to come through the mail, because the systems have never ever been good. And it amazes me that a government would talk about, oh, we'll have this seamless, risk-free AI integration. You can't even make the basic things work. So seriously, get a grip. In the digital health app space, you may have noticed back in June that the University of Cambridge released a piece of research that basically said women's health apps were exploiting their medical data, and this was having an effect by being sold to third parties for marketing and exploitation of women and the sales of women's health products. This is true. The women's health industry is set to be about $30 billion by 2030. And it's no surprise women have had very poor support within general medical systems. So they've gone outside those medical systems, and now what's happening is they're actually being exploited in the alternative systems, but everybody's saying they're getting to the root cause of your problem. What they mean is that they will record your periods, they'll take all of your medical information, but as soon as you're clinically complex, which many, many women are, they'll just bounce you back into the regular medical system. Thereby, they're taking your money at the front, and they're not having to deal with the complex issues, which are often the things that are most costly on the way through. What this research didn't highlight, however, and that I know to be true, having researched women's health apps myself, is that not only are health apps sharing your data with third parties, but the third parties include things like legal services, which has huge ramifications if you're in the United States, as well as potentially employers. And that's not just selling you health apps, that is having implications on your legal standing, your employment, and possibly even your ability to get health insurance. No, we don't have that system in the UK at the minute, but that doesn't mean it's not coming in. One of the most worrying factors about what he says here is that, we're going to reduce the risk here, we're going to make it seamless and make it better for patients. Here's what I know to be true. The government have very little true grasp of the clinical risk to patients on a day-by-day basis. And in order to make an informed assessment of risk, you need to know what the risks are. And this is what I know to be true. They've no understanding of the risks, and they've no understanding of the detrimental effect that choices could make on patient care. Yes, AI is exciting. I think there's potential for it to be very good at diagnostics and treatment, but at the moment it doesn't really look to me like they're using it in a way to actually improve treatments and diagnostics. It looks like they're using it a way towards social control and exploitation of data. Stay informed, stay safe, hope it helps.